everyone, and welcome to our webinar on determining essential core competencies for job positions. My name is Kathleen Amos, and I'm the Assistant Director for Academic Practice Linkages at the Public Health Foundation. And I'm joined today by Elizabeth Rumble, who's the Workforce Development Specialist at Denver Public Health. On behalf of our team here at PHF and Denver Public Health, I'd like to thank you for joining us today. We're looking forward to sharing a new resource to help with identifying core competencies relevant to jobs within public health, and to highlighting the great work that Denver Public Health has been doing to strengthen competencies within their organization. So just before we get started here this afternoon, I'm going to turn things over to my colleague Janelle to run through a few housekeeping items.
Thank you, Kathleen. As you may have heard, all attendees that have joined the webinar are muted. If you called in using the phone, please choose the phone call option in your control panel on the right. If you are using your computers and mics, please choose the computer audio option. The materials for the presentation today are available for download in the handout section of your control panel. These materials include the presentation slides and also the tools that will be featured today. Please use the questions section in your control panel to ask questions and submit comments at any time throughout the webinar, and we will be having a Q&A session at the end of the webinar. This webinar is being recorded and will be archived, and we'll make sure everyone receives the archive following the webinar today.
Thanks, Janelle. So just to give you a quick idea of how we're planning to focus the webinar today, everything that we're going to discuss is tied back to the core competencies for public health professionals. So we'll begin with a brief overview of the core competencies and then talk about a process that we've been working on for identifying competencies critical for specific jobs. As I mentioned, Elizabeth will share some of what they've been working on at Denver Public Health in terms of strengthening competencies within their staff. And then we should have plenty of time for Q&A. So as Janelle just mentioned, and I'll encourage you again to be thinking about what questions you have, and feel free to type them into the questions box at any point as we're speaking. And then finally, we'll close with some tools and resources that can help support using the core competencies. So before we really get into the presentation, I wanted to share just a little bit of background about us. So I mentioned I work at the Public Health Foundation, which is a national nonprofit organization based in Washington, D.C. And we exist to serve the public health workforce and improve the public's health by strengthening the quality and performance of public health practice. We have three focus areas as an organization: workforce development, quality improvement, and performance management. One PHF activity in the area of workforce development is serving as a convener and providing staff support for the Council on Linkages between academia and public health practice. The Council on Linkages is a collaborative of 22 national organizations engaged in public health that works together on initiatives designed to benefit the workforce as a whole. The Council aims to improve the performance of individuals and organizations within public health by fostering collaboration between academia, public health practice, and healthcare, promoting ongoing education and training, and strengthening public health infrastructure. Members of the Council span a variety of professional groups within public health, as well as federal agencies, as you can see from the slide here, and activities, including today's webinar, funded by the Centers for Disease Control and Prevention. So as many of you may know, the Council on Linkages is a group that produces the core competencies for public health professionals, which are a consensus set of skills for the broad practice of public health as defined by the 10 essential public health services. The core competencies reflect foundational skills desirable for professionals engaging in the practice, education, and research of public health. And I think perhaps the most important point, and the one I always emphasize when looking at this slide, is that the core competencies are designed to serve as a starting point for organizations working to understand, assess, and meet training and other workforce development needs. The core competencies can offer a basis for thinking about what knowledge and skills are important for jobs within public health, and they can be tailored in ways that suit your particular workforce or audience. So I hope, as you'll see some examples of this during our presentation today, such as adjusting of language and the prioritization of competencies to help meet particular goals or needs. The current version of the core competencies was adopted unanimously by the Council on Linkages and released in 2014. And these core competencies are organized into two ways. First, they're organized into 8 domains, which reflect skill areas within public health. So these include analytical and assessment skills, policy development and program planning, communication, cultural competency, community dimensions of practice, public health sciences, financial planning and management, and leadership and systems thinking skills. The core competencies are also organized into 3 tiers, which represent career stages for public health professionals. And these tiers are based on the roles or responsibilities that individuals have within an organization. So Tier 1 is designed to meet the needs of frontline and entry-level staff. Tier 2 is aimed at program management and supervisory staff, and Tier 3 is for senior management or executive leadership of an organization. And this image just gives you an idea of what that translates to in terms of the structure of the core competencies. So when you think about 8 domains and 3 tiers, and the way that competencies are written so that really every statement is a distinct skill, the numbers of core or foundational competencies that might be relevant within the public health workforce can quickly add up. And so this table is just a representation of what that looks like for the core competencies in terms of the number of competencies that you'll find there. So if you look even just along the bottom row of the table, you'll see that we have about 80 to 90 competency statements in each tier of the core competencies. And we recognize that this can present a challenge when you're working with the core competencies. So we know that the core competencies are being used for a variety of workforce development activities, for conducting needs assessments, for developing training and training plans, for creating workforce development plans. And with this particular project that we're talking about today, we went into it really wanting to provide some assistance for identifying specific competencies for public health jobs and incorporating those competencies into job descriptions. So competencies are a great way to articulate the knowledge and skills that are key to success within a position. And the Public Health Accreditation Board requires health departments seeking accreditation to provide job descriptions that include the competencies necessary for the job. So as we started really focusing on this and working on this project, one of the first things that we grappled with was the challenge of, if we're going to try to help identify specific competencies for specific types of jobs, how do we really think about 80 or 90 competencies at once? And the way that we began in doing this was by modifying the core competencies to group similar concepts together. So while it's important for competency statements to be very distinct, that may not always necessarily be how we think about skill development. So for example, if working with data is a big part of your job, you're probably going to need to have skills related to a variety of aspects of data analysis. Because there are a number of discrete skills that go into analyzing data, this might be broken up into multiple competency statements. But in terms of identifying an essential component of your job, it might be sufficient to simply talk about data analysis as a core thing that you need to know how to do. So using Tier 2 of the core competencies, we actually went through all of the individual competency statements and grouped competencies together that shared a common theme. So through this process, we were able to take the number of items that you're maybe trying to pay attention to when you're working on this down to 54. And we've been referring to that as our modified version of the core competencies, the first domain and a half-ish of which you see on the screen now. But 54 is still a lot of areas, and simply putting 54 competencies into a job description would make for a pretty daunting job description, I think. No one person can be expected to focus on developing skills related to that many areas all at once. And also, I think it's important to recognize that not every single person within an organization needs to be highly skilled in all of these areas. So you'll likely want a balance of these skills across your organization, but the areas that might be most important for any given individual will vary depending upon the responsibilities they have in their job and the activities that they're engaged in. So working with Denver Public Health starting a couple of years ago, we developed and began testing an interactive process designed to narrow down this list of competencies to focus on the most essential core competencies for different types of jobs within public health organizations. We've been refining this over the last couple of years, and we really recently wrote up this process, and you can now find it as a new tool available on our website. So just to give you sort of a high-level overview of what the tool contains. So this tool describes the prioritization process and walks you through a series of steps to identify competencies that are most critical for a public health job. It's designed to be used in a workshop setting to help engage staff members within the organization to identify and prioritize the competencies that they feel are most important in their roles. Staff participating in this process may be grouped into job categories based on the types of responsibilities they have and the activities they do, with the goal being to group together positions that are likely to need similar competencies. So the workshop involves a two-step voting process that works to narrow down lists of critical competencies needed by staff within a specific job category, followed by some facilitated discussion to pull out any adjustments that might be needed to that competency list. So one of the key benefits, we think, from using this type of process to identify competencies is that you're getting input on what competencies are important from the people who are actually doing those jobs. And at the end of the process, what you should have is a list of about 8 to 10 core competencies that can serve as a starting point for adding competencies to job descriptions or supporting other workforce development activities. So as you've probably figured out by now, all of this process is grounded in the core competencies. And it also makes use of a neutral facilitator. So if you are engaging in this type of activity, it can be beneficial to have a skilled facilitator with good working knowledge of the core competencies. That obviously isn't something that we can really reproduce in an online tool, but those types of services are available, and we're happy to talk with anyone who's interested in discussing that sort of work. In terms of some of the specifics of what you'll find in the tool online, and just as a reminder, you can download a copy of the tool from the handout section of your control panel on the side of the screen. But if you go online to look at the tool, or look at it there, what you'll find are well, first you'll find instructions for conducting this type of workshop, as well as a number of resources to help with that. So the modified version of the core competencies that I mentioned is included in the tool, as is a map that shows how these items within the modified version relate back to the full 2014 version of the core competencies. So depending on how you are planning to use the competencies you've identified, this map allows you to sort of work backwards to the original competency statements if that's desired. The tool also includes a guide for facilitating the voting process. And if you do view it online, you'll also find a couple of supplemental files available from that same web page where you will find the tool. So there are a set of worksheets available in Word format that you can customize and use during the workshop to facilitate participant voting, as well as an Excel workbook that can be used by the workshop facilitator to document the process. And finally, the tool contains contact information, and I really cannot emphasize this enough. So this is a brand new tool for us, and we would love to hear your feedback. Please let us know what works. Please let us know what doesn't work. Please let us know any suggestions that you have that we can incorporate into future tools or for future versions of this tool. We're also happy to hear any questions that you have as you start using the tool. And we always love to hear about how people are using it. So please feel free to get in touch with us at any time. So with that overview, I mentioned that we worked with Denver Public Health to develop this as an on-site workshop. And I think they have done fantastic things with the results of the workshops that we've facilitated for them. So I'd now like to turn the floor over to Elizabeth to talk about their real-life experience of working through this process and how they have built on this for a variety of workforce development activities.
Hi everyone, my name is Elizabeth Rumble and I'm the Workforce Development Specialist at Denver Public Health. My position is out of our Performance Improvement Office, and together with 2 other staff members, our office provides coaching and structure for Denver Public Health Department initiatives that improve the processes and grow the people that advance public health. But before I jump into the case study of how we've used the tool and what we've done with the core competencies, I want to give you a quick overview of what public health looks like in Denver. Denver is unique in that we have an environmental health department and a separate public health department, and together we had to apply for public health accreditation. Denver's environmental health department is housed under Denver city and county government, and they focus on animal protection, community health, environmental quality, and public health inspections. They also host the Office of the Medical Examiner. And then Denver Public Health, which is what I am based out of, is a department of Denver Health and Hospital Authority, which we just lovingly call Denver Health. And that's an integrated health system whose mission is to provide level 1 care to all residents regardless of their ability to pay. So we are the city safety net hospital. Our services within Denver Public Health include birth and death records, clinical care, community health data, educational opportunities, health promotion activities, outreach detection and investigation services, and our public health emergency preparedness. Now, Denver Health is one of the largest employers in the state of Colorado, and we have just over 7,000 employees. And while that's great for us within public health because we can access Denver Health's larger organizational development department and on-site lean department, it also makes us think creatively about how we can adapt these core competencies to our work. So for example, since we are within that system, we can't change a nursing job description to meet one of our TB clinic nurses because it would end up affecting somebody that might be a nurse in labor and delivery who has nothing to do with public health. So in our short time together, I'll share some of the ways that we've adapted the competencies to our work, and we'll first start with the process that we use to select them. If I can get the screen to go. Oh, there we go. So because Denver Health applied for public health accreditation under Standards and Measures version 1.0, our workforce development plan really just included a paragraph that said we have intentions to adopt the core competencies one day, and we didn't quite know what that looked like. And then we reached out to the Public Health Foundation in 2014 and said we need help understanding what this means and what it could do for our workforce. So this timeline that you see on the screen here shows the activities that led up to our survey implementation, which first occurred in June of 2016, so 1 year ago. Starting in December of 2014, we had over 60 people, so almost a quarter of our department, participate in conversations with the Public Health Foundation who came on site to us, and they talked about the importance of the core competencies. They helped us think about how we should categorize our staff for the survey implementation and what competencies should be included in that survey itself. This preparation for the survey launch lasted about 1.5 years, and although that looks really long, I should note that we had some staffing gaps that contributed to this longer timeline. So after having those conversations with the Public Health Foundation and those 60 staff members, we decided to organize our staff into 6 separate groups, which you see on the screen here. Our department did this by spending 3 workforce development committee meetings discussing what groups made the most sense for our very diverse staff. This planning process included taking a master staff list and identifying shared roles or responsibilities. Our intention in creating these 6 groups was to be specific in the competencies that we asked of our employees. Rather than surveying every staff member on all 92 of the core competencies, we really wanted staff to tell us what they thought they utilized more often than others. And that feedback process from our employees helped to create buy-in, so they saw this as something that was meaningful and reflective of their needs. Our department solicited input from representatives of each of these 6 job classifications as to what they thought was the most relevant to their work. And then on top of that, Our Workforce Development Committee selected 15 competencies that we thought if you work at Denver Public Health, regardless of what your title is, or your department, or your job classification, or your tenure, if you are a Denver Public Health employee, we would like you to know these 15 things. And that's that center circle that you see on the screen here. So that would touch all 6 job classifications. So this slide shows examples of the competencies that were selected by 2 of our job classifications, our public health specialists and our data drivers. Representatives of each of these job classifications looked through all 92 competencies, and together through a voting process, they came to a consensus that these 7 competencies were the most critical to their work. So on the left-hand side, you can see some of the competencies from our public health specialists. And as we categorize them, public health specialists really became our staff members that are focused on population-level programming. So as you can imagine, the competencies that they chose that they felt best represented their work has consistent keywords about relationships and partners to improve community health. Similarly, on the right-hand side, our data drivers, which were our staff members that are on our informatics team or our epidemiologist, they chose 7 competencies as well, and most of their competencies had keywords that revolved around analysis or around data. But what we found interesting at the department level was that while these 2 groups of folks worked independently of each other and didn't talk to one another about what they were selecting, they both picked 2 of the same competencies, which you see across the bottom of the screen. They both picked select approaches for disseminating data and information and convey data and information to professionals and the public using a variety of approaches. So while they might express this competency in a different manner through their work, they each felt it was critical to their job function. From February 2015 to April 2016, we continued our conversations with representatives of each job classification to really fine-tune that wording around the competencies. So here in Denver, we started with all Tier 2 language, and then we evaluated through peer testing and peer review if the wording made sense to all of our staff. So this slide shows a screenshot of the Excel spreadsheet we used to track the revision process. All the way to the left, that first column, we listed our department's first draft at what we thought the survey language could be. The second column, description, showed the original language of the competency. That way we could compare to make sure we weren't getting too far off course from what the Council on Linkages had selected. And then that last column all the way to the right that's titled New Wording was the finalized language that we used in our survey. So for many of the competencies, the wording didn't change, but for some of them, very small fine-tuning adjustments made the difference to our frontline staff who said, I don't really understand what it is that you're asking me and what this means. Now, this process took a long time because we made sure that we were taking the new language and vetting it with the staff, asking them for their input, making sure it still made sense to their work, and making sure that they had understanding of what it was that we were trying to assess. And then after many Workforce Development Committee meetings, work group meetings, job classification consultations, one-on-one check-ins with folks that were vetting survey language, we finally got to a place where we had a comprehensive set of questions for the whole department. But our next challenge was designing an assessment scale that made sense to our employees. And we were pleased to hear that you can make up an assessment scale that makes sense to your staff. So instead of using numbers like 1 to 4, our staff said, you know what would be helpful if you gave me words that I could think about when I self-assess. So we came up with this 5-point scale that you see on the screen here. The options started with none, where the employee might say they have no knowledge or they don't understand a topic. Aware, in that they might have limited knowledge of a topic. Informed, where they could state the topic and explain it. Experienced, in that they could apply knowledge and skills related to that topic to their work. Or expert, in that they're highly skilled so much that they could teach others about this topic. If you are a SurveyMonkey user, you might recognize this format, but we've used SurveyMonkey to administer our surveys here, partly because we appreciate that SurveyMonkey allows you to build in a skip pattern based on that individual job classification. So we first asked employees to list their name, to list their program area, and then to list what job classification they fell into. And we gave them options that named some of the specific positions that might fall into each of those 6 classifications. So every employee was asked their 6 to 10 competencies related to their job classification, as well as the 15 department competencies. And to help with our survey launch, we designed a comprehensive implementation and communication plan. Although many of our staff had been involved in the survey design process, many had picked the competencies, some of them had worked through edits on language, we thought it was really important that we had a clear and consistent message to our entire department why we were doing this. And the key message that we came up with and that we told our employees over and over was that this survey is not meant as negative performance management. Instead, our employees should see this as an opportunity to engage in professional development. And we emphasized the word opportunity and communicated that individuals would receive personalized results with the intention that they're meant to help them grow professionally, and that our department would be creating training plans to help advance the work of our department. We really believe this messaging was what helped us have a successful launch with honest self-evaluations, and we had 100% participation from our department of our permanent employees who participated. So to communicate the survey to our department, I gave presentations at staff meetings, manager meetings, director meetings. The presentations at the clinical staff meetings I felt were especially important because we used this time to discuss the difference between clinical competencies and the public health core competencies and why an employee might want to be skilled in both. And then we had department-wide communications go out to all employees, including personalized emails to managers and to every employee, not only to let them know how their staff were participating, what that rate was, but to thank them for taking the time to do the survey. After the survey period ended, we used the month of July to compile and create results for each employee, program area, and the department. So what you see on the screen here is a screenshot of what employees received a month after they completed the survey. And that's really a summary of their self-assessment results. We presented the competencies with their strongest self-assessment at the top and tapered down from there. And the self-assessment referenced the domain from which of the referenced the broad domain from which each of these competencies came from. And we did that intentionally. So if an employee was looking at their self-assessment and they noticed at the bottom all of the ones that they might have scored themselves lower in were related to communication skills, then they could set a professional development goal around communication skills instead of just one competency. Every employee's manager also received a copy of this self-assessment, and we asked the managers to review the self-assessment at the next monthly rounding session that they had with their employee. So here at Denver Public Health, we engage in a practice that we call rounding, where our managers sit down with their employees separate from a weekly one-on-one or check-in, and they ask big picture questions like, how are things going? How can I support you? What barriers are you facing? Is there anybody I can thank for you? What's your progress on your professional development goals? So that rounding is really meant to be a time to check in and to encourage employee development and growth, and we felt that this made sense within that context. So the month of August, we asked them to round around the self-assessment, and then if appropriate, we asked employees and managers together to think about a new professional development goal or to set an additional professional development goal if they felt like they needed to be brought up to speed on something they might have self-assessed lower in. At the department level, with those 15 competencies that we selected for every employee, we plotted them out, and I recognize that it's probably hard to read the competencies across the bottom of this graph, but I show this to let you see that there were some things we did really well as a department, and those are the competencies all the way to the right of the bar graph. So the green on the graph represents the percentage of employees who self-assessed as experienced or expert. The blue portion represents those employees who are kind of in the middle and that they were informed, but they haven't experienced the competency yet. And then the red was the employees who self-assessed as aware or none, and that they might not understand what that competency means. So all the way to the right of the graph, there were some things that we thought our department did really well, but then to the left, we noticed, these percentages don't look that good. Why is it that only 1/3 of our department might be experienced in this? So high level, here are some of the things that we do well. We heard that our employees felt that they could make decisions based on proven practices, and we came to expect that from the large number of clinicians that we have on staff. And we also have a focus on building a quality improvement culture. So that was a win for our QI team. And our employees also felt that they could describe the value of and advocate for a diverse workforce. They felt comfortable contributing to teams, and they felt comfortable communicating with linguistic and cultural competence. But some of those things that we have opportunities for growth around, these would be the ones to the left of that bar graph. These were ones where we had higher percentages of our employees self-assessing none are aware. So the two that are highlighted on the screen are what our Workforce Development Committee felt that we should uplift, and that's about addressing the diversity of individuals and populations when implementing policies, programs, or services that affect the health of a community. We felt that this could tie into our health equity work, and it made sense to have a combined organizational effort around this competency. And then the second was that we were surprised that only half of our employees said that they've ever participated in and or ensured the use of professional development opportunities, especially given the fact that we ask our employees to set a professional development goal every year. So taking that knowledge, we thought, what can we do to uplift these two competencies and to try to move that needle? So one of the tools that we used was a pick chart, and this is a common quality improvement prioritization tool that helps teams organize and identify thoughts and create action plans based on how easy an idea would be to pull off, plotted against how much of an impact it would have. So the PICK, the P-I-C-K, stands for possible, I is for implement, C is for challenge, and K is for kibosh. And it's really those ideas that end up in the I box. Those are the ones that you want to focus your efforts around because they'll have the highest impact theoretically with the least amount of difficulty. So some of these notes that you see on the screen were ideas that our Workforce Development Committee came up with as to how we could create a culture of professional development here at Denver Public Health. And then we took those ideas and we used our organization's performance management system to prioritize the ideas from the pick chart and create a department level action plan for each of those two competencies. So following that same example of trying to develop a culture of professional development at public health, we identified that as our high level tactic. Our metric, that indicator, how will we know that we're successful? In 2016, we only had 52% of our staff identify as experienced or expert in that competency, and our target for this year is to get that to 65%. And then the action plan, what you see in yellow on the screen, are those ideas from the pick chart that we sequenced in order to say, if we're going to make a change on this, what should we do first? How will we know that we're successful? What's the start date? Who's going to help lead it? And when do we hope to have that completed by? The last thing that I am really excited about that we're doing in Denver with the core competencies is that we launched a mentoring pilot program in October of 2016 based on the core competency results. So this goes back to those 8 domains that the competencies come from, things like analytical or assessment skills, public health science skills, leadership and system thinking. But we asked employees as a way to encourage professional development to look and see if there were some of these domains that they felt they could use extra assistance in. And then we looked at the folks that took the survey and identified as an expert in some of these domains, and we tried to pair them up outside of their normal chain of command. As they were willing to volunteer and participate, this was completely optional for our department, but we had 12 partnerships, or 24 folks total, who thought, yeah, I would love to participate in mentoring in this capacity. And they've been meeting at least once a month starting in October, and that's actually going to wrap up at the end of this month, and we'll have a celebration. And I'm really looking forward to hearing what they've learned and to see if their core competency results have gone up in light of this mentoring program. But to do that, we used the core competency domains, and we also gave them a brief assessment related to their communication styles. So we've really done a lot here in Denver in terms of picking the competencies, educating our department around them, creating training plans, and then empowering staff to take it amongst themselves and to work for professional development opportunities. And I recognize that Janelle and Kathleen and I just threw a lot of information at you. So I would love to take questions if anybody has any, or Kathleen, if you want to do your best to field questions. I'd love to hear what folks are thinking.
Absolutely. Thank you so much, Elizabeth. And as Elizabeth just said, and as I promised at the beginning, we do have lots of time for questions. We tried to save a good chunk of time to hear what people are thinking about. So as a reminder, please feel free to type your questions into the question box in your control panel on your screen, and we'll do our best to answer as many as we can. And I think, Janelle, Janelle's going to read the questions to us. So have we had any questions come in so far?
Yeah, we have. We've had several. The first, I think, is for you, Kathleen, maybe. Is it recommended to choose competencies from any of the 3 tiers, since I will be starting from an entry-level position?
Great question. I think we, as I mentioned at the start, the core competencies are designed in tiers, and the tiers are geared towards sort of particular stages, potentially, within a career. But as with all aspects of the core competencies, those tiers are really meant to be a guide. So yes, it is perfectly acceptable to choose competencies from any given tier if they apply. So you could start as an entry-level professional. You could start with the Tier 1 competencies and read through those and see what looks relevant. But if there are competencies in Tier 2 or perhaps even in Tier 3 that seem appropriate for the particular type of work that you're doing, that's perfectly fine to pull those, and weave those into your professional development or workforce development efforts. I also mentioned when talking about the modified version of the core competencies that we created that we used Tier 2, and we did that deliberately, similar to how the core competencies were developed to begin with, but really sort of trying to start from that middle point with the idea that if the concept applies, you could then, sort of move the skill level up a little or down a little as appropriate for the particular types of work that you're doing. I hope that helps. And if not, feel free to send in another question.
Thanks so much, Kathleen. We have another for Elizabeth, and I think you may have covered this, but we do have a couple questions about how many staff work at Denver Public Health, and then also what method was used to survey staff.
Sure. So we technically have about 200 folks here at Denver Public Health, but we've asked our managers to help us narrow down that list as to who should be taking the survey, because that number of 200 includes MPH students that might be coming through for 3 months, or it might include volunteers, or it might include CDC fellows, or it might include, right source staffing folks that come in to help answer the phones. And not that that's not important to help advance public health, but we consider our permanent employees, the ones that we hope will be here for a long time, to be the ones that should drive our workforce development plans, that we should be doing things that are reflective of their needs. So each year we've had, and I say each year, last year we had about 163 permanent employees that we asked to participate. This year we had 167, and we are currently resurveying now. So we're on that annual timeline from June 1st till June 30th. We give them the whole month to take the survey, and we do it through SurveyMonkey. So when we open up SurveyMonkey, we can track participation by asking the employees to write their name. That's the first question. And some of our employees at first were hesitant to do that because they said, well, how will I know that this is not related to performance management? How can I trust that, I'm not going to get in trouble because I say I don't understand something? And I feel like that's where a lot of our communication plan came around. So when I presented, I would tell other staff members, honestly, I feel like I would self-assess, maybe just informed on this. And that's okay, because by being honest, I can help our department build a baseline as to where we should be focusing our efforts. So we tracked the employees through SurveyMonkey. We asked them to indicate their name, and then every week I would have a spreadsheet that listed every employee's name that we prioritized to take the survey and their manager's name, and I would update that based on participation and send out weekly reminders to managers to say, hey, here are your staff that haven't participated in the survey yet. Here's a couple talking points you can share with them as to why they should do it. And here's that link to the SurveyMonkey survey that you can forward along and they can participate on their own time.
Thank you so much, Elizabeth. And kind of in that same vein, we have a question. Would you be willing to share your SurveyMonkey items with others who are doing work with health departments on training needs assessments?
Sure. If that's the actual survey itself, I am happy to upload that as a PDF. You could see each of the questions that our job classifications picked. You could see all 15 that we picked at the department level. And I think Kathleen said that we'd be able to send out resources after this presentation. So I do apologize that they're not included in your handouts, but I'd be happy to pass that along and make sure it goes out with the slide deck and the follow-up email.
Great, and you're absolutely right. We will, Janelle mentioned at the beginning that we are recording this webinar, so following the webinar, you'll get an email that has the archive, the recording, as well as, again, a copy of the slides, and we can include any additional resources that we have available. So we'll sort of be making that all available from one place on our website, and we'll be sure that everyone who registered for the webinar gets access to that.
Awesome, thank you. So this one's likely for Kathleen. Is there a particular format for citing the core competencies? Would it be APA style?
Oh, cool. Yeah. So we do have, I mean, really you can cite them sort of however you want, but we're not going to come down hard on you if you don't use the format we suggest. But we do have a suggested citation on our website if that's helpful. So if you go to our website, to sort of the main core competency section, if you just typed in phf.org/about core competencies, you'll end up in the main core competency section of our website. And within that, you'll find a set of FAQs. And that question is actually a question that we get a lot, so we included it in the FAQs. So you can find a suggested citation there. If that doesn't work, or if those instructions, if that's not as easy as I'm trying to make it sound right now, feel free to send us your email address in the questions box, or shoot me a quick email, and I'll send you the citation directly. Thanks.
Cool, thank you. And Elizabeth, we have some praises being sung as well. Amy McCune just wants to say bravo for such a great job. And then we have another question. Tell me more about the 15 departments competencies. Were these common across all 6 job classifications?
Thank you first for the praise, and I look forward to hearing about other organizations that adopt this and have their own success stories to share. As for the 15 competencies that came up, yes, quite a few of them were picked by 4 or 5 of the job classifications, and we said, well, really, if 2/3 of our department, staff are saying this is important, maybe we should just make it mandatory for our department. But then we also aligned them with our strategic plan and with our CHA and with our CHIP, and we said, if this is what our department's vision and direction is, what makes the most sense to help us get to that space? So it was a combination of, 1, this is coming up a lot of groups are saying this is important, but then 2, our workforce development committee looking at some of those documents, trying to integrate feedback from that, talking to our directors, our leadership, and saying, what do you think that our staff should know? And then really trying to pare it down to a number of 15.
Great, thank you. So when you asked a department for their responses on the SurveyMonkey, were these responses as a team or individual?
They were all individual, and that's a good point that I didn't have in the slide deck here. we really asked our department to approach this through 3 outlets. One, the individual, so it should be really primarily motivated by the individual to want to engage in professional development and increase their personal competency. So we had the mentoring, we had the professional development goals, we had the rounding check-in for that. Then we had the department to say, well, what can we do as a department to push this forward? But then that gray space in the middle was our program areas, and we gave managers aggregate data for their program. So they received a copy of every staff member's personal assessment, but we also said, on a whole, here are your averages. And we had some great success stories with how managers chose to use that information. One team within our epidemiology department, they looked at it and they said, you know, it looks like as a team, all of us are struggling with communication. So can we sit down and look at these questions and say, why did we self-assess lower on communication? What is it about that we could work on? And as a team, they came up with a plan that they wanted to visit different communication activities, do assessments, talk about what they needed from their teammates to have effective communication. They found webinars that they could watch. And as a team, they tried to uplift that communication domain. So that's one example that I know of. At the department level, we didn't ask managers to report back how they might have used it, and I think that was a good lessons learned for us, that, you know, we should be soliciting input, not just in selecting the competencies, but after the rollout to say, what was the most helpful, what other tools do you need to be successful, and how did you use this at your team level? But that's one that came to my mind because that manager was really excited that they had this opportunity within their program to support the whole team as well as the individuals.
Thank you so much. Okay, and we have a question. We still struggle with mistrust when surveying team members. They fear punitive use of results and/or use to downsize in the future, or fear of admitting lack of knowledge. Do you think the voting on competencies helps build trust and buy-in?
Do you want to answer first, Kathleen, or do you want me to go?
Sure, I can jump in with, and I think you'll have to speak maybe to trust and buy-in, but really I think that is one of the things that we hope to achieve with this type of process, where you're really getting engagement of the people working in the jobs, and not just having, say, leadership or whoever say, these are the things we expect you to know, these are the things that you do. And I think by really involving people in the process and trying to make it more transparent and letting people have input into it, I think that does, we hope that does build trust and buy-in for the process as a whole. But I don't know, Elizabeth, if you have any comments in terms of like how that has played out in your health department.
Sure. I mean, I could share a couple stories of things that come to mind, and I think that some teams here might struggle with trust issues more than others, and I feel like that happens across every organization, and I don't know that it's anybody's fault. It's just a product of our ever-changing world and concerns about funding, and I mean, a lot could happen. But here, we tried to get around that issue of folks maybe inflating their scores by encouraging managers to have those follow-up conversations. And we found that those follow-up rounding conversations where they sat down with the employee, there were some employees, because I created every one of those templates for all 160-something people last year, there were some people that rated themselves expert on everything, on all 22 competencies that were asked of them. And I'm not saying that I don't work with fabulous people, because I do, and I feel like our staff is really competent on a whole, but to have somebody say that they were an expert in every single competency when even our directors didn't self-identify as expert in every competency, it kind of felt out of place. And we wondered, well, where does that come from? So when that particular individual's manager sat down with them, and the coaching guide that we gave the managers, we encouraged them to have these conversations to say, tell me about why you self-assessed this way. You know, I see that you self-assessed as an expert in X, Y, and Z. Can you tell me about how you would teach that to me? Or where do you see that in your work? And that was good for folks that might have overinflated because they were afraid of punitive action, but it was also good for our folks that don't give themselves enough credit for the things that they are skilled in. So some managers reported back and they said, you know, it was really valuable and it was a way for me to build trust with my team when I could sit down and say, you know, I see that you said you don't understand what this means, but here's where I see you doing this every day. So let's have a conversation about what this looks like and how can I support you in this process so you feel that you could say you were experienced in this competency. You know, those outliers, the folks that either gave themselves all expert or the ones that were maybe too humble, I feel like they were few and far in between based on, you know, me viewing the results, and granted, I don't work with everybody to know if they were true or not, but really I think those follow-up conversations and having those conversations from a place of honestly wanting self-growth and professional development for your staff helps to establish that trust. So maybe the first year your scores might not be that good, but if they can see in action that this process will not harm them, when you do the survey again, I think that they'll be more open to having a conversation and to being honestly self-reflective.
That's great, and I think I might add just one more, and this is a bit of a detailed piece, so as you look more at the tool, I'm happy to talk more about this with anyone, but the idea of trust and wanting people to be truthful about how they felt about what skills were important, factored in even in when we were originally designing the process, and that is actually where the worksheets that we've made available on the website come from, because the idea was that people could essentially vote on what competencies they wanted anonymously. We've tended, when we've engaged in these workshops, we've tended to have people vote by show of hands, but just because that's how the organizations have been comfortable doing it, but the worksheets were originally intended to help address some of that concern, so that if people didn't want to say publicly which things they felt were most critical, that there would be an option for them to be more private about it in order to hopefully get as accurate a results as possible.
Great, thank you both. We have another, and please continue to feel free to send them in as we answer the ones we have. Do you have any tips for getting senior leadership on board to support this type of workforce development effort?
I mean, I can share here on behalf of Denver. One of our job classifications was directors, so that included our executive director, that included our associate director, and then that included representatives from each of our 14 program areas. So that could be physician directors or non-physician directors, but really having them involved in the process from the beginning. And maybe it would be the same for your organization wherever you might be. I don't know what your hierarchy or structure looks like, but I think when people are brought in from the beginning at all levels, if it's directors or if it's support staff or whoever it might be, then they feel like they're contributing to something that will help benefit the department. And our directors, I think we're fortunate here in Denver that we have folks that are really visionary and they see the benefit of this and they want to make sure that we're able to meet those 10 essential public health services. And instead of recreating a system to figure out what our gaps were, they were really on board and supportive of taking this and adapting it and running with it.
Thank you so much, Elizabeth. Let's see. We'll just do one more question, maybe two more. Do you make the rounding meetings voluntary or required?
The hospital, Denver Health, their suggestion is that it happens at least once a month. Some program areas are better than others about implementing that. I know within my program we do it at least once a month, but I have heard about folks that will do it quarterly. And they have a system within the hospital that you can track managers can track the conversations to see if there are trends that come up about barriers or obstacles. But I think it's highly encouraged. I don't believe that it's mandated that everybody does it here.
Great, thanks so much. And I have a question for Kathleen. Are there other tools to help with use of the core competencies?
That's actually a really good question. You've anticipated what our next slide is. So maybe I'll go there. I realize we're getting close to 3 o'clock, and I want to be respectful of everyone's time. But I also recognize that there are a lot of questions that we haven't had a chance to answer. Please do continue to send those in, and Elizabeth and I will take all of those questions and we'll go through them and we'll write responses to them so that you'll have the answers, and we'll send that out to everyone. So if you haven't asked your question yet and you want to, please do continue to send those to us, and we'll make sure to address them all in some way. We can send that out after the webinar along with the slides and the recording and the handouts, so the tool and other resources that we had uploaded in the handouts box were not uploaded yet. So in terms of particular tools or resources that can help with the core competencies or training that can help to build skills in areas that you've identified, we did put together a couple slides here at the end with some links. These links should all be live, so if you have downloaded the slides or you take that PDF version that we're going to send out after the webinar, you should be able to just click and go to any of these links. But the first link here is simply the link to the tool and the process that we've been discussing today. We also do have a variety of other core competencies tools available online, including, for example, competency self-assessments, examples of job descriptions and workforce development plans that include the core competencies, so you can see how other organizations are addressing that, as well as just other general examples of how organizations are using the core competencies, among other tools. So the link to core competencies tools will take you to a page that has a list of tools that we have available. The Train Learning Network, the largest learning network for public health professionals, offers a way to help build skills in the areas identified as desirable. So once you've gone through a process like this or some other sort of process where you've identified competency areas that you'd like to focus on, this can help you find training or courses to help fill those needs. The core competencies are integrated directly into Train, so you can search for courses related to specific tiers, specific domains, or even all the way down to the individual competency level. And finally, PHF does provide on-site workforce development assistance. You heard Elizabeth talk about us coming out to work with Denver Public Health. So we do provide assistance related to this type of process and in a variety of other areas. There are fees associated with this type of work, but if you are interested in learning more about any of those options, Margie Beaudry is a great contact, and she'd be happy to discuss that with you. In terms of ways to stay current or access additional information, there is lots of information about the core competencies on the PHF website. So that's the first link here. We also have several newsletters that regularly include content related to the core competencies. So if you want to be, the first one to know, to hear anything new that's going on with the core competencies, the Council on Linkages update is a monthly newsletter that includes, it's rare that I can't imagine a month that would go by that we wouldn't include something about the core competencies. Also, PHF e-news and Public Health Learning are a couple of other newsletters that we have here at the Public Health Foundation, and they also often have updates when new resources are available or new events are happening, that sort of stuff. And as we have hopefully been emphasizing, we are always happy to answer your questions. So as I said, if you didn't get a chance to ask your question today, please feel free to type it in. Please also feel free to contact us by email following the webinar. Or, if you happen to think of other questions later that you didn't think to ask today, please feel free to get in touch with either of us, and we would be happy, Elizabeth and I would both be happy to discuss any of this further. And we'd also love to hear your stories. So if there are ways that you're using the core competencies or particular ideas or suggestions that you have, please feel free to send those as well. We're always so enthusiastic to hear about those things. With that, We would like to thank everyone once again for joining us. We do have a very brief evaluation, and we'd love to hear your thoughts. I think Janelle or Ron is going to put the link to, Ron already did, put the link to the evaluation in the chat box so you can access it there. And please feel free to explore our website and to get in touch with us. And I hope you all enjoy the rest of your day. Thank you very much.